Thanks, and welcome everybody to Strategies for Managing Difficult Clinical Research Sites. Oh my, clinical difficult sites. Why would that be? I do have over 30 years experience in the field working with sites. I have to deal with many of them myself on a regular basis. This is a business, and we do deal with people, and people can sometimes be difficult to deal with, even these professional people that we would think have everybody's best interest at hand. I wish I had a magic bullet as to how to resolve all sites and get everybody to do things according to good clinical practice and in good timing. That's obviously not always possible. Our task is going to be to determine, though, what makes that situation difficult. What can we do about it in the business? Often there are sometimes very small things, adjustments that can be made that will make a major difference in the performance of a site. So how can we turn the difficult site around for the betterment of our project so that we're all happy working together and we get good results? With proper techniques and, yes, admittedly some soft skills, which some of us take for granted, some of us have to learn. Some it comes natural, others we have to force ourselves to follow some principles and common sense, shall we say, to some people. With that direction, though, we can often make any site a productive one. Maybe not the best site that we really enjoy going to, but that we can manage, and one that we can maybe enjoy working with in the end. We're going to discuss many ways to help accomplish this today. Each of us is going to have our unique way to implement many of these tips, and some of the methods are going to work better for some of us than others, and obviously different situations will require different kind of action. Some of us are going to rely on our managers a lot more than others. Some of us are new in the field, and we just have to experience this a little bit more, and then it will become more natural for us. This is a challenge that we're all here to face with the sites to which we are assigned. We didn't always pick these sites. Sometimes we did, and we were fooled that we thought they were going to be great compliant sites, and somehow they were not. We need to think about the lessons learned. Here's our learning objective then for today. We all have our own ideas about this, and we want to see how did we get those ideas. We're going to look at what is a difficult site, what defines that. We're going to look at the approaches for dealing with the difficult types of sites. There's going to be different things that will work for different ones. Why is the site difficult? We need to know why if we're really going to help. We're going to develop some trending techniques to anticipate some site issues. Going in, sometimes we can anticipate some difficult sites. Some are more obvious than others. Some can be more proactive going in. They're not all going to be ideal sites. We need to realize that right up front. Did we go out and do the pre-study visit ourselves? Were we told who would have those sites? Do we know when we go to select sites that we're going to be the monitor on that site? All of these have different tendencies for us. Some of us have gut feelings. We can't come back home and say we don't think we would be good at this site. We need facts. What is it about the site that we think could cause us a problem? Do we have any facts to support that? Have we seen this before and it led us astray? Did we have any lessons learned from one of those that maybe we could use, or somebody in our team could help us with that has had a similar fact when they went to a site? Because sometimes it's just the fact that we're going to have that site, whether we like it or not. Management may have said, we're using this investigator for whatever their reason. And maybe we're in their region or have the right qualifications that we're going to be monitoring that site, like it or not. Sometimes we can make a change. Management can very often move sites around if it's to everybody's benefit. It could be a personality issue, for example, and that maybe we're not going to feel comfortable going to that location or that site for whatever our reason that we can explain to management. We're going to be looking at implementing some proactive diagnosis, some techniques to develop a plan, a communication plan. We need to be able to talk to management about this. Is there a plan? How do we approach this systematically? How can we describe what's going on? How can we get action from management? This is a really big issue in many sponsors or CROs. We're also going to describe some techniques for resolving conflict. Conflict in itself is not bad. A differing of opinion can be very healthy. to an organization. So we might want to think about noticing the conflict and addressing that conflict. We can promote some successful outcomes as a result.